Hello students, in the last local anesthetic session, we have learned about the definition, mechanism of action of local anesthetic, the action and toxicity of local anesthetic, and the classes depending upon the chemical nature and depending upon the duration of action. Now, there are distinct class which is depending on the use. You can see there are 5 different classes are there. Now, the number 1 class is surface anesthesia. This drug is mainly delivered by the topical application in the form of mucous membrane in the sensory nerve ending site and superficial layer of the body. Now, the forms of this specific group of drug, we will get the solution, ointment, cream and spread. The different categories of drug which is belongs to surface anesthesia are tetracaine used only 2%, lidocaine which is used 2 to 5% in dose, flutic mixture of lidocaine and benzocaine. Now, what are the advantage and disadvantage for the using of surface anesthesia? It is easy to apply or use, and the disadvantage is it shows systemic toxicity of drug. Mainly, the endoscopic procedure and hemorrhoid or anal sphincter cases are used by this type of anesthetic agent. In case of eye surgery on eye for toncometry process, different type of surgical process to remove foreign bodies from corneal and conjunctival site, and for preoperative preparation are used. Next type of use is infiltration anesthesia. The aim of this anesthetic agent or anesthesia process is to block sensory nerve terminals, and the onset of action is immediate. The advantage of this type of process is it is simple, faster, low cost, very useful for small surgical procedure, and the disadvantage are limited efficacy, short duration of action, potential for adverse local toxic effects. The uses of this procedure are mainly minor surgical process, hydrocele, and in case of hernia. Drugs are enlisted like lidocaine 1%, bupivacaine 0.25%, ropivacaine 0.2%, and prelocaine used 1%. The next categories of use of local anesthetic is conduction block anesthetic or anesthesia. It block the site by subcutaneous injectable. All other nerve coming to a particular field is blocked. It is generally used for the scalp and anterior abdominal wall where nerve travel superficially to supply the area. Generally, it uh, block the nerve, the injected around appropriate nerve trunks or plexuses. Muscles supplied by injected nerve or plexus are paralyzed. The advantage of this procedure, it is small dose of drug provided for larger area. And the disadvantage is technical complexity and neuropathy. It is very crucial technical procedure of anesthesia. So, um, technical person must be very much trained. So their technical complexity are there a big problem. The drugs used mainly lidocaine 1%, bupivacaine 0.25%, levobupivacaine 0.25%, and prilocaine 1%. Now, the type of anesthesia is spinal block anesthesia. It is injected in spinal subarachnoid space between lumbar 2 and lumbar 3 section or lumbar 3 to lumbar 4. The drug used bupivacaine 0.5% and levobupivacaine 0.5%. Uh, this procedure may be used in surgical procedure on lower limb, pelvis, lower abdomen and obstetrics and C-section procedure in case of delivery. The advantage of this procedure is it is safe, affordable, good analgesic property, muscle relaxation and no loss of consciousness are there. It is preferred to be used in cardiac, pulmonary and renal diseases also. And the only disadvantage is it may be the adverse effect also is headache. Now, the last one class is intravenous regional anesthesia. It is also referred as Bayer's block. It is useful for rapid anesthetization process of an extremity, um, generally used for the upper limb and for the orthopedic procedure. The procedure is the limb first is elevated to ensure venous drainage and then tightly wrapped by an elastic bandage for a maximal excess exsanguination. The tourniquet then applied proximally and inflated just above systolic blood pressure. Then elastic bandage removal. Lidocaine is injected by intravenous procedure. Normally, the cuff is inflated for at least 20 minutes to minimize systemic toxicity. The drugs which are used generally lidocaine for 0.5% and prilocaine for 0.5% also. So, what are the side effects of local anesthetics? They are generally safe and usually don't cause any side effect. Um, However, if you are given too much or injection goes into a vein instead of tissue, you might have more side effects such as ringing in your ears, dizziness, numbness, twitching, a metallic taste in your mouth. Now, as we know what are the use of the different types of local anesthetic, but here some um, enlisted topic are related with the use of local anesthetic. It is usually given by dentist, surgeon, anesthetist, um, and other doctors. Depending on what they are being used for, local anesthetics can be given as injection, cream, gels, sprays, or ointment. It is used to treating pain. Slightly painful conditions such as mouth ulcer and sore throat can sometimes be treated with the over-counter gels and spray that contain a local anesthetic, or injection of local anesthetic and steroid medication may be used to treat more severe conditions such as long-term joint pain. Preventing pain during and after surgery. A local anesthetic usually given by injection may be used along with a sedative medication to keep you relaxed while an operation or procedure is carried out. In case of epidural and spinal anesthetic, an epidural anesthetic, often referred to as an epidural, is where a local anesthetic is continually injected process through a tube into an area of the lower back called the epidural space. A spinal anesthetic is a single injection into a similar space in the back. Now, you just have to know what are the difference between general and local anesthetic based on this enlisted features: site of action, area of body involved, consciousness, care of vital functions, more health patient, use in non-cooperative patient, major surgery in case of minor surgery as well. So here the difference, you just go through this proper